from the physician and surgeon's perspective. I do think that's one of the most powerful parts of this, where you can integrate patient-reported outcomes into the point of care as part of that actual encounter with the patient. And I know you've given me a few anecdotes in past conversations where, for instance, in your patient population, spine patients, the power of like what PROs do from almost like a diagnostic or how you can use that data during the encounter itself. So I'd love to hear just some of your experiences and how you think about that.
Right? So prompts have been great for research, but patients haven't really believed it's part of their care because it hasn't been, right? They sort of get cajoled into giving this data, which appears in an article 6 years later and maybe then drives what practice would be. So I think one of the changes we're seeing, and one of the things Patient IQ has done for us that I think is really critical to making this clinically valuable, is we have an interface, a window in our EMR that gives us real time the prompts. And so we're not looking at it in an article a year or two later. We're looking at the relationship between the patient-reported outcomes and what the patient is telling us at that visit. And that was part of our accreditation for our Center of Excellence. The accreditor said, it's great that you're collecting this data and putting it in registries and using it for research, but what we want to see is we want to see it influence clinical practice. And I think if we start to make that change, now the patient will start to think it's important because we're using it in the decision making about their follow-up, whether their rehab is working, a whole array of things. So